Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Jillian Burkhardt. She's an obstetrics gynecology physician. Today's Kevin MD article is The Maternal and Child Health Crisis in Sudan, a call for action. Jillian, welcome to the show.
Thank you so much for having me, Kevin.
So let's start by briefly sharing your story and journey.
I'm an OBGYN currently based in New Mexico for the last 8 years. I started my career in reproductive health as a Peace Corps volunteer, actually about more than 20 years ago, working in Madagascar. And then after I finished my residency in Boston, began working with Doctors Without Borders and other international organizations in places like Liberia, the Democratic Republic of Congo, Sierra Leone. I moved to New Mexico about 8 years ago and was working for several years at an academic health center here as the medical director of our labor and delivery unit and was very engrossed in sort of the COVID response, which had me a little bit burnt out by the time I was, finished with 3 or 4 years of COVID and wanted to return to some of the things that drew me to medicine in the first place and went back to working with Doctors Without Borders about a year ago to really ended up working on the crisis in Sudan in multiple different aspects.
All right, so we're going to talk about that more. Your Kevin MD article is The Maternal and Child Health Crisis in Sudan. So tell us what led you to write this article in the first place, and then talk about the article itself for those who did get a chance to read it.
Yeah, so as you know, I mentioned started working with on the Sudan crisis about a year ago in October. First working on the side in Chad, actually where people were fleeing Sudan into Chad. And in the last couple of months, Doctors Without Borders found that there were alarmingly high rates of maternal death
Hmm.
um, in Sudan. Sudan has become probably the largest humanitarian crisis in the world, with over one in five people in the country displaced internally or fleeing the country to flee violence. And as a result, the healthcare system has completely broken down. And I know there are many crises around the world, both sort of conflict and war and healthcare systems that are falling apart. And it's hard sometimes when we get inundated with so many, but I think I felt that having been working in this uh, country and around this issue for, a better part of a year, wanted to be able to share a little bit of what I was seeing in Sudan. And I worked on maternal mortality in many different countries, including, here in the US. And it it is really hard, I think, when you have pregnant women who are dying in childbirth or after childbirth, no matter where you are in the world, whether you're in New Mexico or Boston or Sudan. But I think, what I was seeing in Sudan is probably one of the worst that I've seen in my career.
So tell us, what did you see during your time in Sudan? What are some of the things that you can describe?
I think what is hardest about some of the acute crisis in Sudan and in Darfur in particular, where I was focused for the last 6 months, is that women are dying from things that we really do know how to treat in the US. People are having deliveries at home in part because they can't reach the facility or because that's culturally sort of traditionally where they feel most comfortable delivering. But then when they have a hemorrhage after delivery, they can't reach the facility. And so women are coming into the hospital where Doctors Without Borders is supporting with hemoglobins of 2
Hmm.
and really are completely, in a state of shock, hemorrhagic shock. And there's really nothing that we can do at that point when they are so critical. People, the most common reason that people are dying in the facilities that we're seeing is actually sepsis, also from lack of supplies from antibiotics. We are facing really severe shortages of supplies, in part due to the conflict and unable to bring things in. And so, the golden hour of treating sepsis within that first hour is really, really hard to do. And so that's the main reason women are dying and newborn babies as well from sepsis due to the, you know, inability to start treatment in a quick, timely fashion.
Now, for those who are not versed in the history of Sudan and the history of violence, so you talked about this bleak picture inside the hospital and the lack of access to healthcare and medications and antibiotics and basic necessities. Tell us how that threat of violence has led to this grim health picture.
Sudan has been in sort of conflict for the last 20 years, but it really sort of erupted again in April of last year, April
Mhm.
2023. And as unfortunately, healthcare facilities are not immune. They have been attacked and just completely destroyed. The facility that I was working in most recently is the Nyala Teaching Hospital. It's a Ministry of Health facility that was a like 700 bed hospital with 13 OBGYNs and a full like ICU and I think they had 10 operating rooms, and now it's like completely destroyed, and there's shellings through the roofs of different buildings, and Doctors Without Borders has renovated the maternity and the pediatric wards, but I think people are scared to come to facilities because sometimes they're targets inadvertently, or and then also I think it's also difficult for people to get into to move around because there's concerns about attacks as they're sort of moving in and out of places to reach the facilities.
And for yourself, what was it like to practice there? Did you feel like your safety was under constant threat of potential attacks? And how did that influence some of the care that you had to give there?
We could not move around at night, for instance. So if there was just sort of for our own, the Doctor Without Borders staff were sort of restricted from movement when it was like in the evenings when it was not safe. And so that, if there was a mass casualty that came in at night, there would be staff that were there at the hospital, local staff, but people couldn't come in and out to sort of supply
Mhm.
support. Personally, I think I felt overall my security was safe, but it wasn't without risk. We did have airstrikes while I was there and did have to respond to mass casualties of the wounded people coming into the hospital. But
It,
I think actually I will say that the local staff actually are really they've been through so much, and they're the ones that have sort of like witnessed this the most, but they are so resilient too to keep sort of providing care and providing the services that are so desperately needed.
and how big was the Doctors Without Borders staff there?
So our staff was actually pretty small in this particular hospital. We had 50 sort of local staff, but then we were supporting the Ministry of Health. And so the Ministry of Health hospital, I don't actually remember the exact number, but we had a couple hundred probably nurses and doctors that we were supporting that were Ministry of Health clinicians and nurses and hygienists and administrators as well.
In your article, you also wrote about sexual violence and how there was barriers in terms of providing care for victims of sexual violence. Can you talk more about that?
Yeah, I mean, I think we are aware that sexual violence has become sort of a weapon of war in places like Sudan. And the actual scope of the problem is hard for us to know. It is very stigmatized, and it's very hard for people to feel comfortable accessing the care that they need after a sexual assault. We have started to see an increased number of survivors coming forward through sort of some community-based models that we're starting to implement, so that I think where there's a little bit less fear and stigma, but it's, you know, I think we don't really totally know what the scope of the problem is, but I do know women are scared to sort of move around, in particular at night, because of fear of being assaulted. And it's sort of hard to, the perpetrators are, both civilian and military. And so we don't know the full scope of what's going on.
And in terms of the message that you want my listeners and the Kevin MD audience to hear, other than this grim news that you're talking about, how can the outside world help? What are some things that we can do to help with this situation?
I think I guess the first thing is to say that people are really resilient, and there actually were stories of survival that were really, what gave me hope about doing this work of, women who come and travel many hours after delivering in rural mountains and have a hemorrhage and arrive and get a blood transfusion and, overcome sort of these grim scenarios. And I think that just sort of being aware of what's happening outside of our own communities while also sort of trying to support locally, listening to your communities wherever you are, whether it be, here in my home state of New Mexico or in Sudan. We're all sort of interconnected. And I think they're also, looking at Doctors Without Borders, there's ways to sort of support the work that Doctors Without Borders in particular is doing, as well as other organizations that are working in Sudan and conflict areas. But like Doctors Without Borders.org is, one way to sort of stay up to date on what's happening and also maybe support as well.
And you said that you were in Sudan for a year, correct?
Well, on and off I was working in Chad first, which was sort of on the refugee response, and then working in two different parts of Darfur on and off for overall it's been a total of about a year.
And then just seeing such dire situations day after day, talk about how that affected you as a physician, just seeing this on a daily basis.
It's hard and sometimes it's discouraging and tiring, but I think there are stories of resilience, and I think that it's also, just like, no matter a physician anywhere, we get touched by the lives of the patients that we care for,
Mhm.
whether you're in New Mexico or Sudan. And I think that's actually what keeps me going. It's the individuals that are coming and smiling every day despite all this. Um, and it's also the Sudanese people that have been through so much and the Doctors Without Borders Sudanese staff that, are still there doing all this work really without, you know, it's sort of an end in sight, but they're able to sort of keep going and keep smiling and knowing that, they're hopefully making a difference.
And do you plan on going back in terms of your next experience with Doctors Without Borders? Well, what are your future plans?
I hope so. Working with Doctors Without Borders, it's sort of hard to know where you'll go next. Taking a little break here, enjoying the sun and green chili of New Mexico. And we'll go back to my hospital here for a few months. And then, yeah, I do hope to be able to go back to Sudan or other places that um, are needed.
Now, for those physicians who are listening to you on a podcast and are inspired by your work and the work of Doctors Without Borders, so tell us how they can help. What are some of the questions that they should ask themselves to see whether they may be the right fit for something like this?
I think working internationally, a lot of people think, oh, I can never do this. But I think being a doctor is a hard work no matter where we are. And so I think taking that sort of spirit of flexibility and knowing that no matter where you are, it requires sort of a little bit of adaptability and thinking outside the box. Having that mindset, I think working internationally is feasible for anyone. But it also doesn't mean that, isn't also for everyone. And there's ways to contribute through supporting the organizations or by supporting local communities and, immigrant populations or refugees that are coming into the US.
We're talking to Jillian Burkhardt. She's an
Mhm.
obstetrics gynecology physician. Today's Kevin MD article is The Maternal and Child Health Crisis in Sudan, a Call for Action. Jillian, let's end with some of your take home messages that you want to leave with the Kevin MD audience.
Thinking about this, as doctors, we're really privileged for people to trust us no matter where we are. And medicine is changing in the US and globally. And I think, we all have our little part to play, whether it be in our small town in rural New Mexico or New York City or Sudan. And I just encourage people to sort of keep working on sort of following your dream of why you became a doctor and sort of, what inspired you to do the grueling work of medical school and residency. And it doesn't matter whether you're working in Sudan or in New York City, there's people that trust us to care for themselves and their families.
Jillian, thank you so much for sharing your story, time, and perspective. And thanks again for coming on the show.
Thanks for having me.